Thanks for listening to PoliticalStorm.com. I'm John Small. We've got a big election coming up here in November, and we've got people on the right asking you to vote for one and people on the left asking you to vote for somebody else. But let's talk about the people there in the middle, all of us, we the people, and what's best for us. Now, there's a lot of different things to look at, but one of the things that we need to look at is our health care. And joining us on the phone right now, we've got Mike King. He's the author of a new book, A Spirit of Charity, Restoring the Bond Between America and Its Public Hospitals. Mr. King, how are you, sir?
I'm good, John.
Well, I appreciate you taking some time to chat with us here. Now, we've got this election coming up, and each candidate kind of has their own perspective on how things should be done in almost every category that we have. But when it comes to health care, how different are Hillary Clinton and Donald Trump? And if you look at some of the third-party candidates, how different would it be if one of those people were elected?
Well, they're about as different as it can be on health care. As you know, with the passage of the Affordable Care Act in 2010 and the implementation of that act in 2014, there was a major effort mounted there to get more people health insurance in the United States. And it's worked pretty well. We've added 20 million people to the health insurance rolls in the country thanks to the ACA. But there's still about 30 million people still uncovered by the law itself. So there's a lot of controversy still connected to the law. A lot of misinformation, unfortunately, still connected to the law, too. But there are ways of, the two major party candidates are approaching that totally different. Of course, Clinton, being the Democrat, wants to build on the ACA and sort of smooth out the edges that still exist there, look for other ways to increase the number of people who have access to health insurance. One of the most important things she has offered is to expand the government's role to the degree that it would make a public option insurance plan available to the members of the public, sort of the way Medicare works. So, as you know now, Medicare, you have to be 65 years of age or disabled to be able to qualify for Medicare. What she would do is to offer an option, particularly to people between maybe the ages of 55 and 65, to buy into Medicare. It might be more affordable for them to be able to do that than to go on these exchanges. That's a major change. And, of course, conservatives worry about that because it's a movement towards what amounts to a true universal health insurance plan like they have in Canada. Mr. Trump's proposal is to scrap the Affordable Care Act completely and take the same position that his Republican colleagues in Congress have taken, which is that you scrap it completely and rebuild a system that's based mostly on allowing for tax credits to people to be able to purchase insurance on the open market and to do away with the individual mandate, the part of the law that requires people to have insurance. That's a huge change, and it would take us closer back to where it was in 2010 before the law was implemented. And that law helped, as I said, sort of smooth out the toughness of insurance policies. If you were sick or had a pre-existing condition, of course, in the past, you didn't have to be covered. An insurance company could say, well, we declined to give you coverage. And the risk here of going back in that direction is that we would lose a lot of people to pre-existing conditions. So they're very different in how they approach this very important topic.
As you look at the third-party candidates, Jill Stein and Gary Johnson, do you know where they stand on this topic, or is that not really something that's been put out really yet?
It's not. It doesn't make a major platform in planking in their platforms. I think, given their independent status, their libertarian status, that they would take an approach that's probably a little bit closer to Republican approach in this, but they have not made healthcare a major factor in their campaigns.
I know when Bernie Sanders was running, he was saying, he wanted to expand things on the healthcare side, free college. There were a lot of things that he was talking about. Do you feel that would have been a good plan?
Well, his call was Medicare for all. In other words, we should make Medicare available to people who are below the age of 65 if they want to buy it. And that was a very big debate that took place in 2010 when the Affordable Care Act was passed. There were a lot of people, advocates, saying the country ought to offer that option of government-sponsored insurance, the way Medicare is taking care is available to people. I think it probably would have helped in the affordability category for more people to be able to purchase insurance if that had been done. And I think it's an option that Democrats clearly are interested in doing in the future.
Again, our guest today is Mike King. He's got a new book called A Spirit of Charity, Restoring the Bond Between America and Its Public Hospitals. Mr. King, where can we find a copy of this book?
Well, it's available on Amazon.com and at Barnes & Noble, Books A Million, and all the major retailers. It's available online in e-edition or in hardback copies, and we'd love to have people take a look at it. There's a big chapter in the book about how we got to where we are today and what might be happening in the future, and maybe that'll help people understand the issues a little bit more and make a better and more informed decision.
Very nice. And I see your website, authormikeking.com, so we can send folks there to learn more about you and find out more about the book as well.
That'd be great. Thank you.
Mr. King, thank you again for taking time to chat with me today.
Okay, John.
Again, Mike King, author of the book. It's a new book that's out just recently, A Spirit of Charity, Restoring the Bond Between America and Its Public Hospitals. And healthcare is a big topic when you start looking at this election. And as Mr. King was just talking about, two completely different plans depending on who it is that gets that top spot. So one more reason to pay close attention to the election and go out and voice your opinion with your vote in November. Thank you for listening to PoliticalStorm.com. I'm John Small.